Hello health champions. Welcome to our Nutrition Health Fitness YouTube channel. Please subscribe and click the bell button if you like this information. Without wasting our time, let's start. Your body weight can be divided into two main categories: fat mass and lean mass. Fat mass is exactly what it sounds like: our total body fat levels. Lean mass is anything that's not fat mass, and can be further broken down into bone mass, muscle mass, water, and organ mass. Now we can see, what is weight loss? Weight loss refers to a decrease in your overall body weight from muscle, water, and fat losses. Fat, muscle, and water can play a role in weight loss. However, it can also occur due to other factors, such as bone mineral or glycogen stores. Glycogen stores may be particularly relevant for people following low-carb diets. Switching from a high-carb to a low-carb diet, you can see a dramatic reduction in weight loss. That's because 1 gram of stored carbs holds about 3 grams of water in the body. This is one of the main reasons why when people go on a low-carb diet, they see almost an instantaneous drop in their weight. But it is important to remember that the change has nothing to do with fat loss. There are other things that can affect weight fluctuations on a daily basis, all of which are normal. Hormonal fluctuations, varying sodium intake, different amounts of dietary fiber, and food sitting in the gastrointestinal tract. Sometimes, people use the terms weight loss and fat loss interchangeably. However, they have different effects on the body and health. Now we can see, what is fat loss? Fat loss refers to weight loss from fat, and it's a more specific and healthful goal than weight loss. Everyone has a certain amount of body fat. This fat is often expressed as a percentage of their total body composition. Women tend to have more body fat, on average, than men. One of the reasons for this is that women need to maintain a higher level of body fat for the reproductive system. Men also tend to have more lean muscle mass, on average, than women for a given weight, which can lead to a lower level of body fat. A male athlete can have a body fat of anywhere from 7% to 13%, compared to the female equivalent of 12% to 20%. Fit and athletic men can be anywhere from 12% to 17%, and female 17% to 24%. An average healthy man can have up to 24%, and women can be up to 30%. If fat can be lost, it must be stored. Excess fat is stored in the body's fat cells, which are called adipocytes. This is where we get the term adipose tissue, which literally means fatty tissue. The most common types of body fat, adipocytes, that are spoken about are subcutaneous fat, the fat between the skin and the muscle, and visceral fat, the fat around the organs. There are others, but these two are the ones most responsible for health and appearance. Fat loss is the breaking down and reduction of these stored adipocytes. We can't choose where we want to lose fat from, and there's no special protocol to help spot reduced body fat. This means you can't exercise a specific area that you would like to lose fat from and hope it works. Unfortunately, if you want a flat-toned stomach, sit-ups alone won't help you lose the weight. Focus on fat loss, not weight loss. When people are trying to lose weight, they might typically weigh themselves on a scale. However, this only tells them how much weight they have lost, not how much fat. Losing fat is more beneficial than losing water or muscle, so it is helpful to be aware of body composition and how it affects health. This video we will explain the difference between weight loss and fat loss and their effects on health. Watch completely this video to find out how to measure fat loss. Many weight loss programs claim to help you lose weight quickly and easily. However, it's important to realize that a significant amount of this weight may include water and muscle losses. Losing muscle can be detrimental, as muscle is a crucial component of your overall health. Maintaining a healthy percentage of muscle has several benefits, such as regulating healthy blood sugar levels, maintaining healthy fat levels, like triglycerides and cholesterol, in the blood, and controlling inflammation. Several studies have linked a higher fat-to-muscle ratio to chronic diseases, like metabolic syndrome, heart disease, and diabetes. Maintaining your muscle mass may also reduce your risk of age-related muscle loss, which results in frailty and potentially disability. Additionally, the more muscle you have, the more calories you burn at rest. This is the main reason why men generally have higher calorie needs than women. Consequently, losing weight in the form of muscle can decrease the number of calories you burn at rest, making it easier to regain any weight you lost in the form of fat. Sometimes when people lose weight, they decrease their muscle and fluid density as well as fat levels. This could result in a reduction in lean body mass and adverse health implications. According to a 2018 review, the negative health implications of a loss of lean body mass are as follows: lowered metabolism, fatigue, declines in neuromuscular function, potential effects on emotion and psychological states, increased risk of injury. Moreover, the metabolic decline that occurs following a loss of lean body mass can regain fat mass and cause unfavorable changes in body composition. The researchers advise that sustainably losing fat mass while maintaining lean body mass is even more important than overall weight loss. There are a few ways to measure body fat, but they're generally only predictions, based on the equipment used, and a mathematical prediction. 1. DEXA scan. DEXA is currently the gold standard of body composition testing. It uses a type of low radiation, X-ray, to determine body fat levels. DEXA scans were originally used to conduct bone mineral analysis, but were found to be useful for testing both fat and fat-free mass, with a high degree of accuracy. A DEXA machine is an expensive piece of laboratory equipment often found in universities, some hospitals, or exclusive private practice. 2. Air displacement plethysmography, BOD-POD. Similar to DEXA, most BOD-POD machines are in universities, some hospitals, or private clinics. Although somewhat less accurate than a DEXA scan, a BOD-POD is able to be used more frequently if needed. A DEXA scan emits a small dose of radiation, so it can't be used on a continuous basis. A BOD-POD machine uses air displacement to determine fat mass. 3. Bioelectrical impedance analysis (BIA). This is one of the less accurate measures of how to determine body fat levels. It involves running an electric current through a scale or handheld device. There's a large margin for error, as well as a lot of variables that could affect the validity and reliability of the readings. 4. Skin folds and girth measurements, calipers. Skin folds can be a very practical and non-invasive way to measure body fat, if done by a qualified practitioner. It involves having various skin fold sites measured with calipers to determine body fat levels. It's worth noting that the sum of the skin folds could be more useful than the actual percentage, as fat tends to shift around the body, and the percentage is an algorithm based on equations. The sum is simply the total of all skin folds added together. Girth measurement performed with a tape measure is a useful way to complement skin fold testing. 5. Pictures. Taking regular pictures can be a great way to measure progress. It requires no special equipment, just access to a camera on a phone. Whilst it won't accurately estimate how much fat you have lost, or muscle you have gained, it will give an objective measure of your aesthetic progress. When most people train or diet for any aesthetic reasons, visible appearance is an important indicator, and a picture does just that. If you're using this method, then just try and keep the variables the same each time. For example, what you wear, the time the shots are taking, lighting, etc. should be kept the same. The more you can reproduce a similar setting, the more visible the difference to your body will be in the pictures. 6. Tape measure. A tape measure can track where someone is losing weight. However, it does not specifically show if the inches lost are fat. Thank you for watching. We hope you enjoy this video. Ending it here. We'll see you on next video soon. Until then, take care. Bye bye.